Evelyn, it is now 7 o'clock. We will start. Give person a few more minutes to come in. We will start at 7:05. Okay? Thank you.
I mean, you can keep this for.
Good evening.
Good evening, Minor.
Good evening.
Good evening, Cecilia. How are you?
I'm doing all right. It's been an interesting month. I had my baby.
You had a baby?
Yeah, a month
When?
ago. The 24th.
Of March? Well, you were supposed to have the baby in March?
No, my
Oh,
due date was April 23rd. But I
I
had some,
know. That's
I had
early.
some complications, not on his part, on my part.
Oh, okay.
He was fine, so I was in the hospital for a bit, and they were like, "Yeah, let's do this earlier."
Which
So
hospital?
Lenox Hill.
We're in Manhattan.
Yeah, Manhattan. It was a pain about to get there, but um, that's what had my last baby. And they were fine, so and they have good
Wow.
food.
And I was thinking about you because I say, hey, I made you a promise, so I knew Let me know when you have the baby.
Mm.
I was not expecting.
Yeah, yeah. It was quite a month. It's been a long month, but it's good. He's good. He's home.
And you doing okay?
Yeah, doing all right. I'm, tired.
Okay.
but,
Give me 1
but
minute. I'll be
okay.
right back so I could turn on my camera.
Sure.
Okay. I was hoping that the other members would have been here already. Log on already. The time we're ready to start. But saying I want to respect everybody's time. So good evening, everyone. Good evening, good evening. It's another month. Another month. Is it Stana? Is that how you pronounce your name? Stana, welcome. Welcome.
you.
I think I'm assuming that you are the person who will be doing the presentation for us this
Right.
afternoon, right?
Yes.
Well, welcome to our community, Health and Social Service Committee.
Thank you.
My name is Francesca Leopold, the chair, the second vice chair on the board, and also the chair for the Health and Social Services. We have Mana, go ahead. You're muted.
Hi, my name is Mary. I've been on this committee. This is my first year on this committee.
Hello.
Cecilia.
Hi, I'm Cecilia. I'll turn my camera for a moment. I'm Cecilia. I'm a resident member. This is my first time being on a community board, so I'm just happy to be here.
And just had a new baby.
Congratulations.
Yes, thank you.
And you look wonderful. If you didn't say you had complications, we would never know.
Oh, thank you.
look
Okay,
great.
he's actually right down there.
Oh, so
Sleeping.
sweet. That's sweet.
Yeah. He's
Wow.
sleeping, which is good. He's a great baby. He's a good sleeper, so be blessed.
Mhm.
But yeah, it's 2 weeks. Well, not two,
Wow.
almost 2 weeks. Yeah, so.
Okay. Okay. Stana, go ahead, introduce yourself.
Okay, well, my name is Stana Nakli, and I'm the New York City Director of Outreach for New York State of Health, which is the marketplace for health insurance in New York State, and it's part of the New York State Department of Health.
Okay, wonderful. So once again, welcome. So before we start our meeting, it is now 7, and then we have Shani, who's just joining us. Welcome. Is it Shani?
It's Shani, yes.
And can you introduce yourself, please? We're just doing an introduction, so you came
Oh.
right on time.
Perfect. Hello, everyone. I'm Shani Aldane. I'm here from Live On, New York. We're an organ procurement organization. We service about 70% of New York State. We are saving lives. It's not necessarily all about getting people registered, but also about having healthy conversations about end-of-life planning, dispelling and debunking myths about organ donation, just about educating and advocating. So many people on the transplant waiting list are people of color. And if we don't have folks that will be matches for us, a lot more of us will remain waiting and unfortunately pass away. But thank you so much for having me here. I'd love an opportunity to present a little more information to the committee at some point if you're open to it.
Okay, thank you so much and welcome on our platform, Health and Social Services. And as I said before, you were just coming in. My name is Francesca Leopold. I'm the second vice chair for the CB9 and the chair for the Health and Social Services. So before we start, I always like to start with an icebreaker. So my icebreaker question for you today, what was the best part of your day? And anyone could answer.
I can start. The best part of my day, which may be a little not much to anybody, but they're doing, my organization is expanding. We're bursting at the seams to the point where seating at our office is at a premium. But we've got these we have so much natural light and tons of windows. So today I picked a spot on our couch next to one of these huge windows, and I just worked. It was one of the most peaceful days I've had, just sitting in the sun, working. I felt like I was in a coffee shop. It was great. So that was the highlight of my day. I still had to work, but it was very peaceful.
You enjoyed it nevertheless.
I enjoyed my day.
Wonderful. I'm not going to call names. I leave it open to you to just unmute yourself and just share what the best part of your day was or is as a.
Well, for me, the best part of my day actually was that my husband took a double baby shift. So I was able to sleep for 5 hours straight. And you know,
yay to your husband.
and it was wonderful. It was really wonderful. And also that my 2-year-old was at daycare today because she's been a handful. Lord have mercy. Adjusting to a new baby is tough. But
Yes.
so it was nice that she was gone for a few hours. We got some quiet. And I had that 5-hour nap.
Wonderful. Wow. I know how you feel. Anybody else will wish to share?
So for me, the best part of my day today was I'm in the midst of buying my first home with my husband. So that is, very exciting. We're almost at the end of the process. So soon we will have our first keys ever in our hands. So we're very excited about it.
Congratulations. Wonderful. That's an exciting thing. I'm telling you, when you get those keys, I'm telling you, if you don't want to go out and if you know you have to sit on the floor, just get that bottle of wine, just pop it and then just sit and just enjoy.
Yes.
Just enjoy it. Congratulations.
Thank you.
Go ahead, Mina. She's frozen.
Yes.
The best
You know, you always have issues with your audio.
Can you?
Yeah, you're breaking up.
Okay.
So certain things we hear, and I don't know. Oh, she's gone. Mr. Purett, good afternoon. For me, I apart from being the second vice chair on the CB9, I work with the New York City Commission on Human Rights. So I go out to do presentations, I do trainings, and I inform. So today I was working at Brooklyn College, and it is they had a youth forum, this youth symposium, and it was just so fulfilling to see, because with the material we have, I'm not expecting that the kids would be interested in stuff about discrimination and stuff like that, but they were coming to the table, they were asking questions, and they were very into it and showing it as to, hey, because usually how our kids, they're into the hair color and all those things. And then a few years ago, I don't know if you remember that this young man in New Jersey, he had the twist, and I don't know if it's the gym or the teacher, they cut his locks, and so I was talking to them about it, and I was giving them the handout on hair discrimination, that it is against the law, for your employer to discriminate against you when it comes to your hair. And it was just so refreshing, and just to see that at 14 years old, they want to work, and everybody coming, are you all hiring? And they just, gone are the days that the kids just want to sit home, they want to earn their own money, So it was just so refreshing that they are just open to learning as to what the law of the city is, and also just wanting to go out there, wanting to earn, earn the pennies, and it was so that really made my day. Okay, so Mr. Pruitt, how are you? All right, so it is now 7:15. Mr. Pruitt, what was the highlight of your day? Just just a minute, not too long, because we have two presentations, so I have to start.
But unless something happens today, I haven't had that moment yet. Unless something happens in this meeting, I haven't had that moment yet. So I'm waiting on this with all the excitement and anticipation I can muster.
All right, Mr.
This is
Pruitt.
the last shot between me and Bear.
It's always good to have you. Mr. Pruitt is our esteemed secretary, and he's just doing such a wonderful job, you know, on the committee, taking our notes and minutes and everything. So thank you so much for the work that you do on this committee. So now, without any further ado, we have a presentation for Marketplace Enrollment, New York State Department of Health. So I'm going to open the floor to you, Stana.
Okay.
Take it away.
All right, I'm going to share my screen so I can go through my presentation. Oh, it's disabled. Is there any way you can enable me to share my screen?
Mia will make you host. She's going to she'll make you co-host. You are co-host now.
Okay, let's see if I can do that. Okay. So can you see my slides?
Not yet.
No?
Nope.
Let's see.
Yeah, we are missing some of our committee members. I do hope they make it to see, you know, see those two presentations. Oh, it's coming up now. Here we go.
Okay, excellent. Okay, so I'm gonna I have about 18 slides to go through, and then if you have any questions about anything, then we can address it at the end. Okay, so again, my name is Stana Nakli. I'm from the New York State of Health. I oversee the outreach, marketing, and communications for the New York City area, so the 5 boroughs, Long Island, and the downstate counties. And thank you very much for having me today. I really appreciate it. I'm going to talk to you about New York State of Health in general, in case you are not familiar, but you know, I think most people have heard of us by now. And then some updates, you know, in terms of what's going on in New York State of Health now. And then most importantly, some preparation that we are hoping to engage your help with as community partners when it comes to public health emergency unwind. So, okay, why is this not moving? There. All right. So just a recap. I don't know if you all have heard about New York State of Health, but basically what it is the official health plan marketplace that came to be as a result of the Affordable Care Act that passed back in 2010 and came into effect in 2013. So it's been around for 10 years. And it's where New Yorkers go and look for health insurance. You know, you can look at the different plans, shop, you know, and compare different options side by side. You can also apply for financial assistance if you qualify. And the programs that we have under the umbrella of New York State of Health is the Medicaid program, the Essential Plan, Child Health Plus for kids, and the Qualified Health Plans, which basically are your standard health insurance plans. You know, it kind of goes Medicaid, Essential Plan above that, and Qualified Health Plans above that. And those can be with or without financial assistance. It depends on person's situation. So we are open for open enrollment right now. So generally speaking, you know, if you are familiar with how health insurance works, every fall between November and December, there is usually what we call open enrollment period, where people that don't have health insurance can come to New York State of Health and get enrolled in coverage. However, because we've been under the public health emergency due to COVID-19 for the past 3 years now, we've had open enrollment period continuously without a break. And the idea behind it was that the federal government basically required all the states to allow open enrollment to remain open so people could easily get coverage, because obviously COVID was around, and if anybody was, you know, getting sick, we wanted to make sure everybody had access to it. So the open enrollment kind of officially ended at the end of January. We are still allowing people to enroll. It's just under sort of a special enrollment period circumstances. It's a little complicated, but basically the idea is that it's still open for people that don't have coverage to come in and get some. We also have the financial assistance available for people that qualified. It all depends on the income and the size of the family. And the financial assistance that's available to help pay for the health insurance is actually larger now during COVID and public health emergency than it normally is. So people that previously didn't qualify for any subsidies now would, because they've been increased because of COVID. So just some important dates to understand how the enrollment works on New York State of Health. So we work on the 15th of the month deadline. So that means if you come in before the 15th of the month, you can get your coverage to begin the 1st of the following month. So today is the 3rd. So if I come in or somebody needs to get health insurance and comes into the marketplace before the 15th and enrolls, their coverage would begin on May 1st. So it's like a 2-week lag. So it's pretty quick turnaround. And it goes on like that forward. So if you come in after the 15th, so April 16th, your coverage would begin June 1st, and so on and so forth. So what is covered in our health insurance plans? Basically, another wonderful thing about the Affordable Care Act was that it required health insurance to become more standardized, so people could easily compare plans side by side and understand what's included in them. So every standard plan now has these 10 essential health benefit categories that you see here. Prior to the Affordable Care Act, this was not the case. So some of the services like mental health and substance abuse or even prescription drugs were not covered under all the plans, but now every standard regular health insurance plan will have these categories, and some even will have additional ones. Also, all the preventive services, so your well visits, are always free. Basically, there is no copay for those for everybody. So we always encourage folks to go and get their checkups and annual visits. There is no extra cost for that. And there is also dental and vision available for people as an add-on if they would like to get that. So here's kind of how it works in terms of financial assistance that is available. And I want to say the only way consumers, people that need health insurance, can get the financial assistance is through New York State of Health. So that's really important to kind of realize, like if you're interested, because this is a government-run situation, the only way to get the financial assistance is to enroll through us. And the way it works is, again, the lowest plan that we have, the program is Medicaid. So if you were an individual, one single person, if your income is up to $18,755, then you would be eligible for Medicaid. If you are above that, so all the way up to $27,180, you would be eligible for Essential Plan. So that's the next level up based on income. And above that is the qualified health plans. And I believe they go all the way up to $106,000. That's for a family of 4. So it's about 400% of federal poverty level. So all the way up to that level, people would be eligible for some type of a financial assistance that would help them pay for their health insurance premiums. So the way to get enrolled in coverage, another thing that was kind of a part of the Affordable Care Act is supposed to make it as easy and accessible as possible. So we came up with various ways for consumers to come and get enrolled in coverage. So you can do it on our website. If you feel comfortable with computers and technology, you can just sign up online, set up an account and do the entire process by yourself. You can call our customer call center, open 6 days a week in all the languages, and you can actually get the entire thing, the entire health insurance application done over the phone. Or you can get an assistance from what we call enrollment assisters. We have, I think, 5,000 of them across the state. So in every neighborhood, we have some certified enrollers. They will actually, it's a really wonderful thing to take advantage of because they're trained and knowledgeable in health insurance, and they can sit down with you and explain everything to you about how health insurance works and actually do the entire application for you. So it's free of charge. There's no cost or anything involved. So we encourage folks that are looking to enroll and don't feel comfortable, to take advantage of these assisters. So there are many wonderful tools and resources on our website that there's lots of information, but I just wanted to highlight few that I feel like are the most valuable. So I was just talking about looking for assisters. So we have this assister search tool available. So basically you just put in your zip code or county. And if you have a preferred language, and you'll be able to search for assisters in your area, you'll have all their contact information so you can reach out to them and set up an appointment to talk about, what you may be eligible for. We are now in Brooklyn, so for Kings County, we have 811 assisters within the county, so that's quite a lot to choose from. And as I said, there are many languages available, and if you don't find the language you need, we can always connect you with interpreter. So these two tools are also really nice and easy to use. So the one on the left is the anonymous plan search tool. So it's basically on our website where before you even commit to anything, before you create an account or go to any trouble, you can actually use this tool and look at the plans that are in your area. So you would just put your zip code in and you'll be able to see all the health insurance plans that you could choose from in your zip code in Brooklyn. The tool on the right is the out-of-pocket cost estimator. So here you'll be able to tell whether or not you are eligible for financial assistance and how much that might be. So you just put in your household size, say family of 4, household income, who all is looking to get coverage, and it will tell you based on the information you provided, you are eligible for certain dollar amount of financial assistance to help you pay for the premium. So really helpful tools. So here's the important part, and this is where I'm going to talk about what is happening right now with the situation with health insurance and where we are hoping that you can help us spread the messaging in your community, and maybe we can discuss some ideas on how we can educate your community about what is coming down the pike. So the public health emergency, this is just some background. Basically, in 2020, the public health emergency was declared by the federal government. It gave states flexibility to allow people to continuously stay enrolled in health coverage. In response to the public health emergency, the requirement into effect where everybody would stay automatically enrolled without having to provide any notice, any proof of income or any documentations that they normally would be required to provide. And the same applied so for Medicaid, the same applied for essential plan and child health plans. So what this means is during the public health emergency in the 2-3 years, the number of people enrolled in these programs significantly increased. So the continuous coverage requirement was now discontinued from the public health emergency in March. And the federal government announced that the public health emergency will officially end on May 11th, 2023.
Excuse me.
Yes.
What exactly is the public health emergency?
So basically, it is all the different rules that came into effect because of COVID. So for health insurance purposes, what that means is, normally before the public health emergency began because of COVID in 2020, if you were enrolled in a health insurance program like Medicaid or Essential Plan, every year you would have to come in and provide documentation to show what your income is. And we would redetermine every year what you might be eligible for, because, we are giving financial assistance to consumers to help them pay for, or even free health insurance, right? So we would ask them, show us your, income. You have to show pay stubs, things like that, like what is your household size, how many people, where are you living right now? So every year people would have to do that during their renewal period. You have your health insurance always for 1 year period. But because of the public health emergency due to COVID, we stopped doing that, and people basically didn't have to do anything at all. They didn't have to show any documentation or anything. But that is now ending. And that is why this is such a big deal, because we have 9 million people in New York State that are enrolled in these programs, being Medicaid, Essential Plan, and Child Health Plus. And for the first time in 3 years, they're going to have to take action. And if they don't, they will lose their health insurance coverage. And this is like unheard of, large scale, operation. And we are really, really worried that people will not do what they're supposed to do and go into their accounts and, provide the required documentation. And all of a sudden they will go to a doctor or a pharmacy and find out they don't have health insurance. So that's what we're really, hoping to avoid. So as you can see on this slide, Since the pandemic started, due to COVID, in the 3 years, 2 more million people have enrolled in coverage because we were not requiring anybody to provide any proof of anything. So people were able to enroll. So that is a huge increase, you know, in enrollment. So now we have 9 million people that will need to do something in order to keep their coverage. We are sending out notices, and actually that's my next slide. You know, this spring we started to send notices to everybody, but you know how it is when you get a notice. I myself get million mail pieces and I don't always, you know, pay attention or open them even, or, you know, read them. So we send notices in mail, we send notices in email. We actually are encouraging people to sign up for texts so we can let them know if something needs to take place, that they need to take action. But even with that, we feel that it's not enough to make sure that the public is educated about what is coming down the pike, and we are engaging all our community partners everywhere. We're working with libraries, all kinds of grassroots, organizations in all the neighborhoods to make sure that if they're able to help us pass this message on to their community, that the consumers are informed about what is coming down the pike and what is happening. So this is gonna first affect people whose coverage is going to end in June. You know how when people enroll in health insurance coverage, not everybody has the same start date and end date. They enroll at a certain time and they have a coverage for 1 year. So it's going to be sort of on a rolling basis throughout the year that people will need to do something and come in to their account on the health insurance marketplace and provide what we are asking them for. Update their address, update their household size. Did they have any new children? Did they got divorced? Did they move somewhere else, different zip code or different county? Did their income change? Do they have a new job? All of those things will be required to be provided. And once we get that information, we sort of recalculate what these people are eligible for in terms of the health insurance program, you know, based on their income and household size. And maybe they will be eligible for the same thing. Maybe they will be eligible for something new, something better even, but it has to be done. And if they don't take that action, then they will lose their coverage, which is, you know, we don't want anyone to have to face that. So that's why we're engaging, you know, in this really robust public education campaign. We're doing ads everywhere we can think of. This is what we were doing to kind of alert people that they should stay connected with us, like sign up for text messaging. This campaign is ending. The next phase of campaign will begin in a couple of weeks, and we'll urge people to take action. That's the next phase. You know, we were hoping that you connect with us, but now we actually need you to take action. So here is, you know, we have a lot of different tools on our website. We have this public health emergency toolkit that we developed for partners like yourselves and other community partners, where we provide everything is ready. Like we have fact sheets, we have infographics that show what people will need to do. We have videos, we have posters, you know, we have email messages ready to go. You can, if you have a way to email your community, we have blurbs for newsletters, all kinds of things that you can possibly think of, social media posts if you're active on social media. And we're just asking our partners to take this, that's all ready to go. We have it in multiple languages. We can send it to you, print it in however many quantities you may need. And we're asking that you basically spread it around your neighborhood in any way you can think of, creative ways. We, you know, like to come, and that's my next and last slide, is this is what we are hoping to do, you know, co-brand materials if possible, share social media posts. If you have events, community events, we go to a lot of health fairs, street fairs, community fairs, those type of events where we can have a table and have somebody sit there and give out information, answer questions, that type of a thing. So that's sort of why I wanted to meet with you. And I've been having a very wonderful experience actually with community boards, because they reach such a nice, small, compact pockets of neighborhoods, you know. And just for your information, the largest enrollments in public health insurance programs is in Brooklyn, Bronx, and Queens out of the entire state. So that's where the biggest numbers of people that will need to actually take action are concentrated. So that's why we are focusing our efforts mainly in these 3 boroughs out of the entire state right now, because we feel it's extremely important to kind of spread the message and make sure that everybody is aware of what is happening. So that's end of my presentation. Here is just like our information with, you know, the number for New York State of Health and our website. But I'd be happy to answer any questions or clarify any things that you may have.
So I am truly, if you can unshare now.
Okay.
Oh, I'm assuming everybody, whoever wants to take the information, and I'm assuming that no, I just lost my train of thought. I really do like the presentation, and whilst you were doing the presentation, I'm thinking, so I have to present when the executive board meets, to have a word with them, to discuss it with them, to see if at least, because it's not a very long presentation, to see if you could present at the next board meeting, general board meeting. So
I'd be happy to.
I don't think the assistant manager, I don't know if she knows as to what the agenda is like. I guess it's too early to see what's the Mia, will you have a pack agenda for this meeting, or we should schedule for next month?
I'm sorry, Fran. I was trying to troubleshoot something with Khalid in his meeting behind the scene. I didn't hear what you said.
I was saying that presentation is a presentation that we should really bring to the board.
Mm-hmm.
So what is the well,
the only for April we have I believe that they're going to do the treasurer's election. I'll touch base with Dante and we'll get back to Stana and update her, let her know if we can get her in. We'll see what the agenda is shaping up like. Remember, we have the big gap for Passover observance. So the next few meetings don't happen for another week and a half. So we don't know what the general board agenda is going to look like.
Right.
So Stana, we can get back to you. Dante will definitely update you and alert you if we can bring you in for a general board.
That sounds great.
I would really like to see that presentation. And also, I'm the chair for the review board at Kings County Hospital, and my meeting is the 3rd Thursday of this month. So I have to check because I had scheduled someone to do a presentation for me. So I will check with the public relations to see if they are still on. So your information, I will get your information from the board office, and I'll get back to you to see if I can put you on the program for this month. Definitely for next month, I would like you to come to the general board meeting, the CAPS board meeting at Kings County Hospital to do a presentation. But also I need to tell you we do a lot of tabling. There's a lot of tabling, and this is one of the ways that you could really spread out the message to let persons know what is happening. So I will also keep you abreast as to where they are having tabling, so that you could, if you can go there yourself, but you could send someone to the tabling there to give out the information. And then you can also reach out to send some of the information to the board office, the flyers. You could send them to the board office, and some of the electives. You can also send this information to the electives as well. Go ahead, Shani.
Cool.
I'm sorry, I'm Stana. Go ahead.
No, I was just saying that all sounds really great. That's exactly kind of the assistance I was hoping that you would be able to provide. So I really appreciate that.
Yeah, because I do a lot of tabling. So usually, and as a matter of fact, Mia, if you don't mind, if you could just forward me her information, because when I go to the office, there are a whole lot of tabling and persons are sending me flyers at my office, and they're at my office. So I'll look to see what I have, and then I will forward those to you so you can register with them.
Okay, so thank you.
Okay, go ahead, Shani.
I'm just, me too. I want to jump on the bandwagon. But no, if you could please also add me to your mailing list, that would be amazing. And if there are any opportunities for Live On New York to share information, either here, a full presentation here, and our presentations are about, they could be as short as 15 minutes or as long as, maybe about a half hour.
Okay, so I'm and I just want I just want to say, Stanley, you can stay with us because I know some of the others may want to ask questions, but because I know Mr. Pruitt will want to ask questions, but Mr. Pruitt, could you go ahead and ask a question because I would like Shani to give us like a 5 minutes.
It's a quickie. I happen to notice, maybe it's my eyesight and old age, but on the sheet that had the benefits that the various insurance companies cover, I didn't see emergency room services or surgical care. And though I was impressed by seeing mental health issues, that's kind of novel for you guys. But tell me about surgical care and emergency room services.
Yes, so that is considered a part of standard care. So yes, all the standard health insurance covers that as well. Just kind of for like a general education, how it works with health insurance, you will see when you see a name of a plan, they will have ST in it, which stands for standard, or NS, which stands for non-standard. So all standard plans have this kind of set package benefit, but the non-standard plans may have additional things added to it, like things that are unusual, like acupuncture, acupressure, things of that nature. But pretty much all plans have all those basic things, which emergency room visits and the surgical care is considered to be standard care. So yes, all the plans will have that included. And you will, if you go to our website and look at the tool that I had on the slide, the search tool, you can actually look at the plan details and see every single thing that's covered and what the copays are and so on and so forth. So you can kind of browse around and compare side by side.
And all of those services are what's the word? In circuit and what's the word I'm looking for?
In network?
In network, yes.
Yes.
They're all in network. Okay.
Yes,
so
those are considered all standard services. Yes.
All right. Okay. Thank you.
You're welcome.
Rosanna, what I wanted to say to you also, I'm gonna also ask Mia, I know she's listening, that she can forward you the flyer. So May 3rd, am I right? May 4th, we'll be hosting online mental health forum. Okay, so you can also attend. You could come on to here. We already have a panel, but I'd like you to I'll call you on. So if you do come on, just to highlight the mental health aspect of it, as to what persons need when it comes to insurance for coverage. So what they can do to get coverage, to get the necessary services that is needed under the Medicaid or the Medicaid services that you have, or whatever services under New York State that persons can insure to get the services that's needed and resource for mental health. Because I realized, as Mrs. Pruitt said, I realized that, and I was very happy to see mental health was one of the services covered. Okay.
Thank you.
Yeah. So I will have when we're working on the flyer right now. So when the flyer is ready, but just put a save a date. And if you don't have anything, you could just reach out to the office. It will be May 4th.
Got it. Okay, I know
At 7, and it's on Zoom. So then you can forward it to other persons and invite them to come on as well. So go ahead, Shani. I'm gonna give you 5 minutes to give us a little bit more on what your service is, or what you're expecting, persons to do when it comes to donorship.
Well, what I'll say is, one of the things that, as I was mentioning earlier, of course, our main goal is to get folks registered to be organ donors. But right now, especially in communities of color, the most important thing that we're finding is having conversation, giving accurate information. There are so many myths and misconceptions about organ donation and transplantation swirling around in our communities, that I've heard people saying that don't get registered because as soon as you register, few months later, something's gonna happen to you.
Both hands up, both.
Something is gonna happen to you.
That I was waiting for you to finish. I didn't want to cut you off. I was waiting for you to finish, because when I went to get my citizenship, I did click donor. And when I came home, my sister was like, "You did what?" I said, so I said, "What?" You said, "Girl, you don't know that. You don't do that."
They coming to get you.
A few months. You go to the doctor. Don't go to that doctor. You dead. They would kill you.
Exactly.
I was scared. I was so scared.
Oh, and at first when I heard, I've been at Live on New York for 2 years. However, my sister received a kidney and a pancreas about 6 or 7 years ago. So I guess it was just divine that I started this job. But those are definitely some of the myths and misconceptions that we're up against.
Could you identify yourself again?
Say again?
Could you identify yourself again?
Shawnee Aldane from Live On New York, LIVEONNY.
Okay, all right, thank you.
So I'm always looking for opportunities where I can chat with people and give them accurate information. I'm able to couch that information or that discussion as it pertains to voter rights, voter, information, voter training. Also able to couch it within end of life planning, which is also very important. Your wills, your trust, your healthcare proxy. That's another alternative to to formally registering, is letting your family know what your wishes are. Because if something happens to you out in the street, when the EMTs come, they're not checking your wallet to see if you're an organ donor. Right. They're trying to save your life. And they're going to get you to the hospital. The doctors that are working on you, be it that grave, the doctors that are working on you also do not know and are not stopping to ask or check if you are an organ donor. It is only when you come to the point where you have passed away or passing away, is imminent, and that is brain death or cardiac death. But once you pass away, and you have to pass away in a very specific manner, you have to die on a ventilator. So everybody is not even a candidate for organ donation. So when you pass away, then a call is made to our organization, Live On New York, and we will come and we will speak to the family about organ donation. Now, I'm sure you can imagine what a difficult conversation that's going to be. Even the people at our organization that fulfill that role, I commend them, I honor them. I couldn't do it. But imagine having to have that conversation with the family after they've just lost a loved one. It makes it much easier if that person has already had the conversation and has let their family know, these are my wishes, this is what I want to do, and or you formally registered to be an organ donor. It makes life a lot easier for your family during that time. And you'll be able to leave a lasting legacy. And I'll just leave you really quickly. One of our volunteers had a baby when I think she was 18. Baby was 5 weeks old. Baby passed away from SIDS. Just so happened, and this was, I believe, at Kings County Hospital. I think it was Kings County, or it was at Woodhull, one of those hospitals. But baby passed away at 5 weeks to SIDS. Turned out there were 2 other babies that needed a heart, the other needed a kidney. She made the tough decision to let her child, to donate her child's organs after, they had passed, and they did everything to try to save her baby. She attests to it. She said they did measures that they don't normally do to save the baby, and there was just nothing that they could do. She made the tough decision to donate Fast forward 21 years to today. One of those babies, just last year, I believe, so not today, but last year, one of those babies was pregnant with a baby of her own. So had she not made that decision, a whole generation would have been wiped out or would not have happened. So just leaving that with you, that you could leave such a wonderful legacy when you pass away and have no more need for your lungs, your heart, your kidneys, your liver, your eyes, your skin. So you could be a blessing to someone's family. But so that I'm just looking for opportunities to share this information, to educate. Like I said, we could talk about voting, end of life planning. It does not have to be about you need to be a registered organ donor.
Is there
I just want
an
people to
think
have
a
the
few
proper
years-
information.
is
a few
there
years
an age
ago-
limit?
Mr. Spirit, you saying
Is
something?
there an age limit?
There is not an age limit. Our oldest donor, I believe, was 95. Typically, they give their liver because it regenerates. So no, there's no age limit.
Somebody from Livon, New York, they did come to the cabs and then they made a presentation. But then the cab members we had, it's a new group that we have. So again, I would get your information. If you can just send your information to you know how to get to CB9, right? You're right.
I
So
will
if you
definitely
can,
send my info.
yes, send the information and let them know. Ask them to pass it on to me.
Okay.
And then I will make an arrangement for you to present. And when we look at our community board, our community debate on the structure and the different committees, I'm sorry, at the time limit, we're gonna have, I think, the longest presentation we could have in maybe 15 minutes, but I think that is suffice for Stana, because your presentation, I don't think it went as far as long as 15 minutes. So I think, and then even with Live on New York, you could always, condense the information. Because even what you just gave us there was just a lot of information in that just short space of time. There was a lot of information. And these are type of information that I would love for the community to get, because you came the right time, because this committee, I'm looking forward, like every month or every 2 or 3 months, to have a health segment on the general board meeting, so we could present something to the community. And then also we have the prison council meeting, and the prison council meeting, you can also come on the prison council meeting. And Stana, I would really like for you to get in touch with me, because for the prison council meeting, I would really like you to come to do a presentation, because we have a lot of the seniors, who comes to those meetings and stuff. And if you come in person, they are not virtual. The prison meeting is not virtual, it's in person, but the hospital meeting is virtual, and as well as the board meeting. So I'm looking forward for, and I also, Shani, I will also send you information as to where they're doing the tabling, so you can also join in and come in.
Thank you.
And table with us as well. So thank you so much, ladies, for coming. Thank you for sharing the information as well received. I'm very, very happy to hear. And then just on Monday, I went tabling somewhere in Bed-Stuy, and there was someone tabling from Live on New York. And then I was telling her the very same thing. I was like, hey, they told me if I didn't sign on, I will die. But it's quite a few years now, I'm still alive. So I know it's just—
Wait a minute, at the health fair?
Yeah.
That was me.
That was you?
Yeah.
By Lawrence?
I was there at the health fair, yeah. That was,
So
it's a small world.
I know it's a small world, and I guess my hair is different. So
wait a minute. Did I give you a pin?
Yes, you did give me a pin.
That
and
was you. Yes, we stopped and talked.
you gave me a pin and you said,
I
well, you
did. I
donate
gave you
already,
a
so you could
pin. It's such a small world.
very, very. And I didn't even recognize you, and you didn't recognize me because my hair,
No.
I had the long braids, and I
Mhm.
just changed it, and I just changed it around.
Oh,
Small,
wow. Awesome.
small world. That's small. I didn't make you recognize you either. Wow.
Wow. Wow. Well, great. I will definitely send you my information.
Yes, please. And did I give you my card?
I don't think so.
Okay, so
I
if
think
not,
we just got caught up talking.
I know. So yeah, so connect with the board and they will give you my information and we'll connect. Because I have a lot of events coming up. So for both of you, I will be sending you all the information and we'll connect. We'll see each other at some of those events if you can make it. All right. So thank you so much. And
Thank you so much.
yeah,
Thank you.
you're very welcome. So board members, please stay on. We just have to discuss the mental health forum coming up. And I mean, I'm not running you guys. If you all want to
It's
stay,
okay.
yeah,
you.
but still,
Have a good evening.
have
Bye.
a good evening. Thank you. Okay,
Right.
for
Have a
coming.
good night, everyone.
Bye-bye.
Okay, have a good night.
Thanks for coming.
I did send the Mia do have the sample of the flyer that we're looking to send out. So she's going to work on it. Mia, Enid, she's not feeling well, so she was at. Mia have this.
I'm here. Yeah, I'm here. Khalid and I were working on the flyer today, so we'll send it out a draft to the committee tomorrow for any additional input, so we can get it going and get it circulated, so you guys can begin sharing it within your networks. But we'll have it nailed down by tomorrow.
Okay.
If I can cheat,
hold on a minute, Mr. Puri. Mia, mute yourself, please. I don't like to hear my voice. Thank you. I spoke to Enid, so I will forward the text message that she sent me. She sent me. Did you give you the name of the person who's supposed to be presenting from One Brooklyn Health?
No, you can send it to me. Send me the name.
All right. So I'll just forward you what she sent. And then I will get the names of the person from things. Well, I know it's Dr. Whitney, but I have to touch base with her to make sure she's the one who's going to present, or she'll have one of the other doctors to present. And then also, what's her name? Karen. Karen will give you the name of the person from the DA's office. Mia?
Yes, I'm sorry. I have to apologize for my terrible Optimum service tonight. This is just horrible. Yes, Karen forwarded the information. So I'll forward the flyer. And then when we have the confirmation of all the speakers, I'll send that to the committee as well, so everyone has clarity about who's doing what on that day. And we can put together a run-up show.
Yeah, okay. Thank you. Okay. I also have to get the person's name from Kemba. And I think any additions, Mr. Puritt, go ahead, my dear.
Yeah, I mean, I know that you guys don't want to spend a good time uselessly, but I was curious if I could get the names and the specialization areas the speakers are gonna be talking about, but it sounds like that's premature at this point, right? I mean, I would just like to know for my own self and the people I tell this to, what various aspects of mental health are we going to be talking about, or the experts are going to be talking about? Is it possible?
So the person from One Brooklyn Health will be addressing. His name is Kino Bob, and he will be more or less presenting for the mental health in the Black community, how the understanding of the Black community, how they perceive mental health, and how they react to it. So that's basically what he'll be talking about. And then Kings County will talk about the services and the things that they're doing and the in-house service they have and what they're doing to help the persons with coming in for service. So there is one that's really bringing awareness, right? And then the other one is actually the service and the treatment of the issue of itself. And it's also the person coming from the DA's office. I don't know what the angle that person is taking, because I did not speak to the person, so I don't know what's the angle.
Well, I had a chance to talk to Karen Crawford some weeks ago, and I kind of stressed that, you know, with so many police killings of innocent people and these psychotic episodes, that and she said that there's a DA who handles those kind of psychotic episodes where mental illness crosses the line with criminal justice. And so that's what I was trying to convey to her.
Okay, so I also have someone from the precinct who will be coming to speak to us, and what I really need to know and need them to address is as to what are they looking at, you know, when it comes to mental health, mental illness. What are they really looking at? How they addressing it? Okay, someone call you and they say someone is acting irrational. When you get on this scene, what do you look for to know, okay, this person has a mental issue? Because it was brought to my attention that police officers, they do take, some of them do go for training pertaining to mental illness, so they know what they're looking at and how to deal with persons. But many a times, a lot of those persons, when they are dead and gone, then you're hearing, well, this person was mental, you know. But then, and whoever that is sent on the scene, because I remember a few years ago, the gentleman who was killed on Utica Avenue, a lot of persons knew him, a lot of police officers knew him. So anytime he started acting irrational in the community, the police, they would call the precinct and then they will send those trained officers to calm him down. You know, I remember also a few years ago on my block, there was this gentleman who, he has a mental illness, he has mental issues, and he had a gun, he was just shooting the gun in the air. Persons called, as a matter of fact, persons called the precinct, and you know, the airwave or however they call it, California called, because California, they get it in California, and then California called back New York, because strange enough, New York, they are not the ones who get the signal. California get the signal. All the way in California, they pick up the gun shoot the fireworks. Then they could tell, when they call here, they could tell them, pick point and say, okay, this place, they had a shooting over there. And then the police then would come over. And then he came over. When they came over, he was right on my block, and he ran down and he started hiding the gun and everything, and he pulled out the gun, and they fired shots at him. But when they fired the shots at him, they never hit him, because he refused to stop, and then he pulled the gun, and then they did not hit him. They hit the building, and they had him on the ground, and then they kicked the gun away from him. And the police officer says, we know him. You know, he's a regular at the prison. So they knew that he had an issue, so they didn't go to kill him, right? So when he was doing what he was doing, I think one of them shot him in his leg because he started fighting. And my husband was telling me, standing in the window, and my husband was telling me, they keep saying, don't move. And then the officer put this woman standing next to him and saying, please don't move. And he's trying, you know, but they knew who he was. So they tried with him, and they took him to the hospital. And then they sent him to the psych ward. He got treated, and he came back, and he's out there on the block. So there are some police officers who really go out of the way to really do what they're trained to do, and some of them, they just don't care. They just do this stuff how they want. So I want one of them, and I want specific questions, not just leave it open-ended. I just want specific, at least 3 questions or 4 questions to the police officers, so they can answer the questions. And I'm not gonna give them the questions for fun. So, you know, I just want to ask them the questions so they're able to answer right there and there.
Do we know
the keynotes? Yeah.
Do we know if mental illness, the mental illness crisis is getting worse, or is it better reporting? I mean, it seems like we didn't have this stuff 20 and 15 years ago.
Well,
I wonder if it's better reporting in the newspapers, or is it actually getting worse?
I can't really answer that. I think when the experts come on hand, they will be able to answer this question, because I really don't know. But Kemba, I think it was you or somebody else who spoke about Kemba, and they said that Kemba had resources that they were given. So these are some of the persons who will take part, but the keynote speaker will be is more or less from One Brooklyn Health, right? And then the other persons is Kings County Hospital. When the flyers come out, send it out to your friends, send it out to persons you know, put it out there on Facebook, put it on however, just bring it out there, because I just want it to be our open, community wide, not just in our district for CB9, but I want it to be open to just send it out, in the community. So it's virtual, so person can hear, because whatever affects across Eastern Parkway, it trickles down to our community. Whatever happens here, it trickles back to the other community, and vice versa, and different areas. So as far wide as we can, the different community boards, all the community boards, we could send the flyer to community board 14, to community board 17, to community board 8. I have already spoken to community board 8 and let them know that we'll send the flyers to them, right? So, and if we want to send to other community boards, it's fine, whoever organizations that we want to send them to, we send them to, and let everybody come on, and then persons can put, interestingly, well, we don't have the chat open for persons to, because we don't have the chat on our network, but I'm hopefully that persons we have enough time for persons to, because it has to be more than an hour. We have to do like an hour and a half, because 1 hour is not enough, so and that's basically it. So Minor, and the help that I need from you, because I know that I am swamped. I don't know what your workload is like, but when I tell you I'm swamped, I am swamped. So I have to be at my office. I have to be out. I had to leave Brooklyn College to run to get back here, to get here, because if I didn't make it, I would have called you to ask you to run the meeting for me, but I had to get here. So one thing that I would really like for us to do is to kind of have this little dialogue during the month, and so that you can just forward. I could maybe just text you as to what I need sent to Mia, and just like a week before our meeting, to just send her the agenda for me, please. Because sometimes I'm out on the street, and sometimes, there's like 2 days before, the day before, the morning of, she have to remind me as to, to the agenda. So if I could just send it to you, and then you can just, bullet point it. Because just send her what you want, because you already have the template. She'll just enter it in there, So I mean, not for this month, but for next month, because we have 2 more months for meetings before we go into vacation.
Does that include an opening statement from us? What Mia is getting together, does that include an opening statement to explain the agenda and the expertise of the various speakers?
No, we are not. That's not what I'm when the agenda, the monthly agendas that we have to send out, that the board office have to send out to let persons know what's on there.
I mean for the health, for the mental health discussion.
That's
I mean, would there be somebody to talk about, give an opening statement, a brief opening statement about why we're there and what the various expertise?
I'm taking care of that. That's runoff show. I'm taking care of that. We have to work on we'll be working on the runoff show and get that going. Yeah. What were you saying, Mina?
Specifically talking about regular monthly meetings, so not for the May 4th, but for.
Can't hear you.
I'm sorry. I thought shutting everything down would help. No, still?
That's better.
Yes, better? Hey, can
I don't know, sometimes you move and then you say something and then it's like you move something and you just lose it again. A while ago you said no, better, and we heard it so clearly.
This is so sad. I'm sorry. I do have that also. So you're asking for regular monthly meetings, not for the May 4th meeting, but for the June and the July meeting?
Yeah, just, yeah. Yeah. So whatever that's coming up, whatever that we have to do, you know, because just for the meetings, it's just to send her the agenda as to what we're doing. You know, yeah. So if I'm out and then, you know, and I could just call you or something and say, hey, you know, this is the agenda, or even before. And if I can do it, I'll do it. It's just if I cannot do it at the time, you know, and then I don't know if you have Mr. Pruitt's number, because I don't know if it is. I'm happy that you were there, but because we don't necessarily need everything that was discussed in the minutes, just the main important things in the minutes that we're highlighting. And I always like the attendance, and I'm happy that we have the attendance. So I'm keeping attendance of the committee members who are supposed to be here, and then especially the board members who are supposed to be persons in the community who are not coming, that's fine. But then the board members who are supposed to be here, who are not here. So I'm keeping notes of that as well. So if you are there, even though Mr. Pruitt, he's taking the minutes, but then if you could just keep some notes of yourself, so just in the event that he is not able, something happened, he's sick or he's something go on and he's not able to send the minutes, at least you have something that you could just submit for the minutes.
Are you saying that my minutes are too detailed, they're too thick?
No, your minutes are perfect.
All right.
Your minutes are perfect. No complaints. I thank you very much. Yeah, so now, so we have this, going. This is June, and this is April, and you know, the month is going on so quickly. So I was looking at I have the WhatsApp group. So I will be adding Mr. Pruitt's name and mine. Is just that I didn't have your numbers to add to it. So I could have let you guys know that. So you definitely, what's your number, Maina? Are you on WhatsApp?
Yes, I am.
Okay, what's your number? Do you mind giving it to me?
I'll text it to you. Don't say it over the video.
No, yeah. Because we're live. Sorry.
Right, yeah.
Sorry. Okay,
Mina, I believe I have it. I'll send it.
Yeah, so send me Cecilia's one as well. And Mr. Pruitt, so I can add them in the WhatsApp, so we can have that, we can be communicating in there.
I don't mind giving it to you. I don't mind giving it to you now.
No, it's okay. They have it, so I'll get it because we are live. We were live on Facebook. Okay, so what time is it?
8:15.
Oh, okay. We are going past our time. Well, anyway, but we had a short presentation, so that was a great presentation. So when it comes to the, I'm looking forward to the mental health forum. I'm really looking forward to it. And any information or anything, by tomorrow, I'll be in the office tomorrow. So you'll get the WhatsApp thing for me that I have you in there. So any correspondence, you need to send me a text or anything, just communicate. I'll check it, just communicate with me, because sometimes I'm not able to call, you know, but if I'm at lunch or I take a break, you know, I check to see what's up. Okay.
All right.
So Cecilia, let me see your face again and let me see this beautiful baby. Thank you guys again for the support, for always being there. And Cecilia looks so beautiful, like nothing happened, like she was on vacation and she just came back. Wow.
Thank you for sharing.
Yes, you're muted though.
Of course, no problem. He's a good baby.
Yeah.
He sleeps. I've got no complaints.
Sorry, so I am very busy, but you know, just let me know you want me to reach out to you. Anything that I can do to help you in any way, let me know.
Okay, thank you.
If you need a Sunday to sleep, just call me. I'll come and babysit.
Come scoop them up.
Come and scoop him up. Okay. Thank you guys very much. Have a good night. Enjoy the rest of the week. And if
Okay.
anything, who knows, if you look at your chat and in your WhatsApp, I might just say, hey, we're gonna have a quick meeting to finalize stuff, to look over stuff, okay?
All right.
All right.
Thank you.
Have a good night. Thank you.
Bye.
Good
All
night,
right.
everyone.
Bye.
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 Bye.